This is Don Sharp with OBR, and I'm here again with Dr. Lucio Gordan. If you'll recall from last time, Dr. Gordan is a hematologist-oncologist with Florida Cancer Specialists. And Dr. Gordan's interest was originally in programming, software development, and then he went to medical school and did a career shift. But what's kind of interesting now is that Dr. Gordan has taken an interest in the oncology-specific EMRs and specifically applying them to this large community oncology group, Florida Cancer Specialists. Good afternoon, Dr. Gordan. Good to see you again.
Thank you for having me here again, Don.
And thanks for your time. And we did an interview in part one. Now we're on to part two. I thought I'd recap part one quickly. And last time we talked about a number of things, some of your features with an oncology-specific EMR. We talked about how an EMR can increase productivity and efficiency within a practice. And then compatibility with a large practice like yours, a group of satellite offices, and how those new practices come on board and operate within your EMR. So I thought I'd take it to the next step and ask a couple more questions related to. And so first thing I was going to start off with was, if you had to name a quick list of the three things that you find most valuable in an oncology-specific EMR, could you name those?
Yes, I think number one, obviously, is having the clinical or oncology regimens, the chemotherapy regimens, ready in the system, and they are vetted by a group of people in terms of the accuracy and the indication and the NCCN designation or other guideline designation. So having a regimen ready saves a lot of time because, it pulls the chemotherapy doses and the pertinent laboratory studies, radiological studies, and echocardiograms, for instance, that we need to do before or after treatment. So that would be number one. Number two, I think the ability to integrate with clinical trials, I think that's very important. We're able to use clinical trial regimens within an oncology-specific EMR, for instance, and we are able to populate the patient's chart with that clinical trial and all the specifics instead of doing by hand, which would be a tremendous amount of work and time wasted or spent. Number three, the ability of having order sets for a specific diseases process that we're doing the workup, so saves time. It always also reminds the providers what specific tests that need to be ordered for a condition that's being analyzed. So
if I could interrupt for just a second there. So were there in the days of paper charts, how did you get order sets?
Well, they were either non-existent, they didn't have an order set, or you have a paper or a form, and you just circle the laboratory studies that you needed to order. For instance, you're doing a workup for a patient with deep venous thrombosis or anemia or gammopathy, so you'd circle and like we would any laboratory request. So that was kind of messy because there were papers flying all over the office, so not very helpful.
Yeah. I would imagine as you go about your day, you run into things that you wish your EMR did. And then you immediately begin, I'm sure, to think about how you can enhance the EMR. Have you run into that in the past?
There's some features that we want to have added to an EMR. For instance, would be nice if we could import images from a PAC system, for instance, into the EMR. Not all EMRs are able to do that. So if you could copy a result of a CAT scan or a specific image of that CAT scan in the patient's chart, I think that would be a big plus. I think the other issue that comes up is the clinical pathways. Having ability to have pathways for each specific payer or specific guidelines would be of help, and not all EMRs have that yet. And that's a controversial area. Whether everybody should be able to deploy pathways at this point, it's something that not everybody agreed upon. So, but I think these are the main issues that I would like to see happening in an EMR today. Of course, we have a wish list that's pretty long, Don, that we with our EMR, and but we play by ear as to what we need for that specific time.
Yeah, and if you did really want to get an enhancement done, I guess you could get that. You could go back to the vendor and talk to them about improving the EMR.
Right. I think most vendors are receptive to listening to ideas, especially good ideas, things that make sense, that improve the way we practice medicine, and enhances the speed and reliability of the system. And enhancements are usually welcome. Of course, we always want to give a specific idea or suggestion to an EMR vendor, so they have to filter what's important for them and what's important for other clients that have the same EMR. But in general, my experience is they have been very receptive, and they adapt really well.
Yeah, it's a sort of an evolving field, so I would hope so. Let me go back to guidelines and pathways. Are NCCN or ASCO guidelines loaded into your EMR right now?
We have chemotherapy protocols that are based on either ASCO or NCCN guidelines, or information that comes from vetted institutions, or things like UpToDate.com. So we have Medscape has also a list of regimens that they provide for each specific disease. So right now we do have a database for every specific every type of cancer and their specific chemotherapies. We're still organizing the setting, make sure we separate adjuvant and first line, second line, third line, is metastatic, and but most of the regimens for the most relevant diseases or more common diseases are organized as we speak. So, but that's an evolving field, Don. As you know, there are new indications every week and new drugs, and we have to clean up the regimen, and we have to adapt new regimens or older regimens to that specific patient. A doctor, for instance, in South Florida, asks us to do a specific regimen or change the interval here and there. So it's an evolving field, as you said. It's a daily work that we have a team of technicians working with us.
Yeah, so you do have IT support within the practice to help you with these.
Oh, most definitely, yeah. We have a team of at least 13 people or more that really help us, and we are very well connected with our EMR vendor, who is very responsive to our needs. And so definitely, yeah, we have a team of a lot of very smart people and hardworking people to help us.
Yeah, if it's like corporate America, the IT department is the fastest growing segment within the company. And then I was just going to ask, you said payer-specific pathways too, and I guess maybe this question may not be answerable even, but you're a large practice in a state with an older population, right? Sounds like an impossibility to have pathways that are specific for every payer. Is that right, or could you? What if there was a dominant payer? Could you look, access their pathways in an ideal world through your EMR?
Well, as you said, and it's a Herculean effort to get all specific regimens for each payer. I think EMRs in general have the ability to isolate or to put specific chemotherapies in specific silos for a specific payer. If, as long obviously these chemotherapy regimens obey all the NCCN or ASCO guidelines, obviously we always want to do treatment for the right reason for the appropriate clinical scenario. Mm-hmm. So I think it's possible if one chooses the main players as far as the insurance companies governing the practice or the state, etc. So, if you have 20 different insurances, it will be hard to have 20 different silos. But I think for the most important or the biggest one, we can work with the vendor to adapt to most of them.
Yeah. Two more questions, and I will let you go. I wanted to ask, sort of off the record, we have talked about, you said, quote, I'm at war with the local hospital system, and I guess just wanted to ask you real quick about compatibility across hospitals. I think that's an enormous issue for you in terms of productivity within your practice, and so just a few words on what the battle is that you're trying to get through here.
Yeah, the war is almost over here, which is always good.
That's good.
We obviously the level of compatibility between our system and our hospital system was zero. Firstly, the systems don't talk, and the way that we do the input of orders for tests, radiology, chemotherapy order sets is just completely different, or actually non-existent. So what I did, we got closer to the hospital IT and to the medical directors and to CEO, etc. And we are working with their IT department to develop chemotherapy regimens for that specific EMR that they have, order sets. So essentially, our local group in Gainesville reviewed all the chemotherapy regimens that are hospital-based chemotherapy and others to go into their EMR. So it's a process like we're developing a new system for the hospital. It's very laborious. It takes time. You have to do everything again. But at the end of the day, you want your patient treated, and you don't want to waste your own time trying to find where the orders are, where the chemotherapy goes, and which labs to order, when and how. So we're trying to work with the hospital, but there's so many different systems that supply the hospital electronics or IT department that it's a challenge. It's definitely a challenge. I'm lucky that I have to work only at one large and very good hospital, so that makes my life easier. But I have several colleagues in South Florida and others that have to make rounds in 2 to 4 hospitals. That is an interesting scenario.
And I imagine you hope that the work you put into in this system with compatibility will then translate to make it easier the next time around with other hospital systems in the world?
Yeah, I think so. It has paid off significantly here. In the last 2 months, I think at least 80 to 90% of the orders I have entered were electronic, and there's still a steep learning curve for me and for the system and others to adapt to our needs. But it's much better as compared to a year ago, for instance.
Yeah. One last question I was going to ask. We've heard about meaningful use and qualifying for meaningful use, and then, getting some payment out from the government as a qualification. And you have a big practice with a lot of physicians, and how is Florida Cancer Specialists doing in keeping up with meaningful use?
Yeah, that's an excellent question, Don. We were heavily involved with our OncoEMR, which is our vendor for the oncology-specific product that we have. And early on, meaningful use was integrated into the system when we entered the patient's charge for the visit that day, the new patient charge or return. Then questions pop up in the screen to answer the meaningful use specific needs, and our level of compliance and success is extremely high at Florida Cancer Specialists. I can't tell you the percentage, but it's close to 100. So we have been able to harvest the benefits from meaningful use from a financial standpoint. So it helps us and helps meaningful use people who do the analysis. So, but you have to have a EMR that assists you and doesn't give you more extra labor or extra layers before you move on to another patient. So it has to be a system that is 2-3 clicks and you're done.
Yeah. So obviously a practice that's tech savvy, which helps accomplish that goal.
Yes.
Well, listen, Dr. Gordan, you've been a great resource to us, and we want to keep the discussion going, and very thankful for your time today. Thanks a lot for sharing your thoughts on oncology-specific EMRs with us.
Thank you so much, Don. Appreciate it.
Okay. Have a good night.